Hello everyone, let's talk about management of discolored teeth. How can we manage a discolored teeth? A discolored teeth can be treated or managed by a technique called bleaching. First of all, what is bleaching? Bleaching may be defined as the lightening of the color of the tooth through the application of a chemical agent to oxidize the organic pigmentation of the tooth. Then let's talk about bleaching agents. There are four commonly used bleaching agents are there. First one is hydrogen peroxide, then sodium perborate, carbamide peroxide, then OTC agents which is called as over the counter agents. How can we bleach a discolored teeth? For that the redox reaction will happen. Tooth itself is a reducing agent. It takes up electron, and bleaching agent which we are using, which is an oxidizing agent which gives free electron. Then free reactive radicals react with the unsaturated bonds in the teeth. Then larger stained molecules are converted into smaller ones. Then simpler molecules are formed. This reflects the less light or become colorless. Then comes to classification of bleaching. There are two types of bleaching. First one is intracoronal bleaching and then second one is extracoronal bleaching. Intracoronal bleachings are of two types, walking bleach technique and in-office thermocatalytic bleach. This intracoronal bleaching is done in endodontically treated tooth or non-vital tooth. Then comes to extracoronal bleaching, which is also called as vital tooth bleaching. In that we have two techniques. One is in-office vital bleach, another one is at-home vital bleach. Then comes to the most commonly used bleaching technique, which is walking bleach, which is used in endodontically treated teeth or non-vital teeth. Before doing a bleaching, we should prepare a teeth. Crown of the teeth to be bleached should be relatively intact. Some features are there which is not recommended for bleaching. Those are crown weakened by a axis preparation or large or multiple restorations or large caries lesion teeth. This is not recommended for bleaching. Then comes to endodontically treated teeth should be that root canal filling should be well condensed, radio opaque with no voids and well adapted to the root canal walls to prevent percolation of the bleaching solution into the periradicular tissues. Then what are the indications for walking bleach technique? First one is discoloration of the pulp chamber. Then dentin should be discolored. Then discoloration not amenable to extracoronal bleaching. Then comes to contraindications. Superficial enamel discoloration can't be bleached by walking bleach technique. Then defective enamel formation, then severe dentin loss, then presence of caries and discolored composites. These teeth are not bleached by walking bleach technique. Next comes to methods of walking bleach. For that, prepare the tooth for bleaching by polishing the enamel surface with a prophylaxis paste. Then apply petroleum jelly to the gingival tissue around the teeth for protection against tissue irritations like hydrogen peroxide. Then adapt the rubber dam. Then re-establish the access cavity. Then remove any gutta perca root canal filling that extends into the pulp chamber with a hard finger plugger or Gates glide and drill to the level of crest of alveolar bone condensed with finger plugger to 1 mm apical to the cemento-enamel junction. Then remove any residual debris or stains in the pulp horn and along the incisal edge of the pulp cavity with a small round burr in slow speed contra-angled. Then seal the orifice of the root canal with at least 1 mm intracoronal barrier over the gutta perca by using GIC, resin modified GIC, then MTA or tricalcium silicate cements. These are all used to prevent the percolation of the bleaching material into the apical area. Then keeping the bleaching agent from the cervical area of the root canal may prevent cervical resorption. Mix sodium perborate powder with distilled water. In case of severe stains, use 3% hydrogen peroxide and then it may then form a thick paste in a clean dampened dish. Then carry the thick paste into the pulp chamber with a plastic instrument or amalgam carrier. Make sure the entire facial surface of the pulp chamber is covered with the paste. Then place a small cotton pellet slightly moistened with H2O2 over the bleaching paste. Then seal the access cavity to a thickness of 3 mm using a adhesive material. This ensures a tight seal around the margins and prevent the leaching of bleaching material. Maximum bleaching effect is attained about 24 hours after the treatment. Patients should return in 3 to 7 days for evaluation of the result. Then bleaching of endodontically treated teeth in office, otherwise called as heat and light or thermocatalytic bleaching. First one, a loose mat of cotton is placed on the labial surface and another is placed in the pulp chamber of the teeth to be bleached. Then loose cotton mats are saturated with 30% H2O2. Then that solution is activated by exposing either to light or to heat. Then to the subjected to several, usually 5 to 6 minute exposure, and bleaching solution is replenished at frequent intervals. On completion of the bleaching process, a pellet of cotton moistened with H2O2 or H2O2 and sodium perborate is sealed in the pulp chamber until the following appointment. Alternative to activated H2O2 is the application of thermostatically controlled electric heating instrument or stainless steel instrument heated over a flame. Then comes to bleaching of vital teeth in office. It is one of the type of extracorneal bleaching. This technique generally uses 35% hydrogen peroxide, which is directly applied to the teeth. Available in gel form, either application of the heat or light to activate the bleaching agent. Hence it is called as thermocatalytic bleaching. Then indications. Discolored teeth as a result of mild fluorosis, tetracycline stains can be bleached by this technique. Then in severe discolored teeth, bleaching could be performed to lighten the tooth color before restoration with bonded resin or porcelain veneers or crowns, in order to match the existing color of the crown that is lighter than the natural teeth. So these are all the indications of bleaching of vital teeth in office. Then comes to methods of vital teeth bleaching in office. First, take a radiograph to detect the presence of caries, any defective restorations and proximity of the pulp horns. Then well sealed small restorations and minimal amount of exposed incisal dentin are not usually a contraindication for bleaching. Evaluate the tooth color with a shade guide and take clinical photographs before and throughout the procedure. Must one is protect the gingival tissue with Orabase or Vaseline and isolate the teeth with rubber dam. Then do not inject the local anesthesia. Then place protective sunglasses over the patient's and the operator eyes. Clean the enamel surface with pumice and water. Apply 3 to 35% H2O2 liquid on the labial surface of the teeth using a small cotton pellet or a piece of gauze. Then bleaching gel containing H2O2 may be used instead of a solution. Then apply heat with a heating device or a light source. This will activate the solution. The temperature which is used for heating is 125 and 140 degree Fahrenheit, which is 52 to 60 degree centigrade. Then treatment time should not exceed 30 minutes even if the result is not satisfactory. Remove the heat source and allow the teeth to cool down for at least 5 minutes. Then pumice is applied on the teeth to remove the residual exposed gel from the enamel surface. Then comes to the bleaching of vital teeth at home. At home bleaching is most commonly used technique because it is easy for the patient to perform and also less expensive. Then it uses a custom fit tray with 10% carbamide peroxide. Then indications for bleaching of vital teeth at home. Superficial enamel discoloration, mild yellow discoloration, brown fluorosis discoloration, age-related discolorations can be bleached. Then contraindications. Severe enamel loss, hypersensitivity teeth, bruxism, caries presence, coronal restoration